Hello everyone, I'm Meena Noronha and I'm back with another episode of Walk the Special Path. In today's special series, I have with us a very special person. She's a nutritionist and consultant dietitian by profession. She's a consultant at My3 Specialty Clinic, Mangalore and visiting faculty for Vaksha, Manipal University. Welcome Chhaya ma'am to our program today. She's a professional with 10 years of experience. She has headed the department of BSc Food Nutrition and Dietetics at Pana UG College, Bajpayee. She has also worked as HOD of Diet Department at AJ Hospital and Research Center, Mangalore for a span of 3 years. Presently, she is a consultant clinical nutritionist at My3 Specialty Clinics in Mangalore. She also visits hospitals and nursing homes at Mangalore. She is a member of Indian Dietetic Association, a scientific body which is affiliated to the International Congress of Dietetics. She has qualified with the first rank in MSc Dietetics and Applied Nutrition from Manipal University. It's a pleasure to have you, ma'am, here today with us.
Pleasure
and I think there are many special parents out there who are very worried about nutrition aspects of their special needs child. So today in this episode, we are going to speak about nutrition for special needs child. If any parent has queries, please do write to us. And Chhaya ma'am is going to tell us more about this topic of nutrition among special needs children, which are very important part of their treatment, of their well-being and mental well-being as well. So, Chhaya ma'am,
yes.
First of all, welcome to this show.
Thank you.
We are doing a series of episodes on special parents and children, more of awareness and mental, physical well-being. I think nutrition is one of the most important aspects for a special needs child.
Yes, very correct.
So, can you tell us more about the connection of nutrition to special needs children or young adults as such?
Okay. Firstly, I would like to congratulate on the work you're doing, ma'am. Not just you, in fact, hats off to all the mothers out there of the special needs children, and particularly you who is doing such great work. So, it's not an easy task. So, particularly nutrition itself is a challenge for normally all the children and adolescents.
Yes, true.
And being with special needs, the mother, the parent, I would say, both mother and father, the effort they have to put to ensure right intake, it's very challenging. And it's not at all an easy task. So, I would like to congratulate you first.
Thank you.
So you just asked about the what would be the nutrition challenges, right? What is the connection between the nutrition needs and particularly why it is important
to come to special needs.
Yes. Why? Because mostly all the disabilities or most neurological related disorders, it could be autism spectrum diseases or something like cerebral palsy or any such motor and cognitive related disorders, the children will have a very unique relationship with food. I would not always say negative relationship with food. It is not really negative actually.
Yes.
It is what they perceive it to be. Because they have sensory issues, they have motor issues, they could have dysphagia, which is swallowing difficulty. They could perceive what texture you perceive a particular food, the child may not perceive the same way. So for them it would be more of sensory issues. So that is where sight, smell, touch, everything plays a role, and for them it plays a role in a very unique way. Okay, so it seems like a negative relationship with food. We feel they are very picky, choosy eaters, but it's not that. It's actually because of the special needs they feel that way. So particularly what we see is deficiencies due to less intake. So mostly there is reduced intake. There could be overeating. Okay, there could be overeating or not always overnourishment, I would say. It could be overeating of unhealthy food. Particularly in special needs children, the parents just see that there is adequate calorie intake and whatever the child is okay with, they tend to give. Just to concern is the weight gain or concern is that child should be happy. So if this food makes him or her happy, I will give this. So that is what we see. So it is not well nourished. It is mostly overnourished. Okay, which is more calorie intake but less nutrient intake. So nutrient plays a very important role.
So if
there.
Good nutrition can always help in the good mental well-being of a special needs child.
particularly so many micronutrients, which again in our today's talk we will touch upon certain micronutrients which particularly are important for cognitive development, motor and cognition. Okay, so
I think every parent should know about these nutrients.
Exactly. So it's more about nutrient density of the food they should understand, and not the caloric density. And as such, with their condition, they are disabled or they are not very mobile, so they will be less active and they could be overweight already, because of the mobility. So you really don't have to give a lot of calories. You have to focus on variety, nutrient density, and balance. So balance is what is lacking most in most cases.
Very true.
Yeah.
So how good nutrition can help in the mental development of these children, because these children may have different issues.
Yes.
Sometimes mentally challenged, behavioral issues, whatever issues.
Exactly.
So a good nutrition, how much it can help in their mental development?
Yeah. So here what I would touch upon is particular micronutrients. So this doesn't really start once the child is diagnosed. Actually it starts right from pregnancy, I would say. The mother's health. So the mother, what food she intakes, definitely these are genetic disorders. The children are predisposed because of the certain, in the gene or in the DNA makeup. But the mother's nutrition intake during pregnancy, particularly in the first few weeks, is very important for the neural development. So you would all have heard of folic acid, the folate, right, which is very, very important.
They're given to pregnant mothers.
Pregnant mother. So initially the pregnant mother, before conceiving, till up to 28 days, or it should be there, like the stores of folate should be really good, because the neural tube is the first that closes in the child, and that if that does not happen, there could be other complications, and not just these autism or other disorders, even these neural tube defects causes disability later on. So folic acid, very important. So folate is given as supplement, because from food what they get will be needed for their own requirement. For additional fetal requirement, it will be given as supplement. So the pregnant mother itself should make sure she takes the supplements. The initial first trimester. Other than that, other important nutrients would be omega-3. So this I would speak even in terms of child's intake. So any child who has any type of motor or cognitive impairment. So omega-3 fatty acids, again all I would have heard of it, right? Omega-3 is quite common. So omega-3 always is not required as a supplement. Particularly in our part where we are there, the Dakshin Kannada and other coastal districts, we get very good amount of fish, right? So fish, particularly what fishes we eat, that would be sardine, mackerel, and all the good oily fatty fishes have very rich amount of omega-3. So please encourage children to have fish. So there are a lot of myths again, right from the child is weaned, that is after 6 months. Even weaning is happening early, so there is 4-month weaning, 5th month weaning, they stop breastfeeding, and that should not be there. It should be at 6 months, and right when they wean, please encourage all types of food. So most parents tend to give only purees, only very small amount, only a small amount of grains, I would say, or vegetables are chosen and given. Only this, like only bananas or only one particular vegetable. That will make the child deficient.
So you see, all type of vegetables are good.
Should be introduced. In fact, fruits and vegetables should be introduced in the beginning of weaning. Grains can be later. Fish, I would say, introduced right from 7th-8th month. May not be in 6th month. Your child's digestive system should improve for that. So white fishes or fish in simple form, steaming it or slightly, in oil, you just, touching, drilling it. So such things the child will like. Make it in form of like maybe cutlets, wrap it in something and make like finger foods. So please encourage omega-3 fatty acids. Now mothers would have a question that omega-3 is found in non-veg, so how a vegetarian child will get it? Not necessarily. It is present only in non-veg. It is very well there in walnuts. Simple like walnuts, flax seeds, these are very good sources. Whole pulses also will legumes will also have some amount. Nuts, particularly walnuts, so it is easily available also. And now chia seeds, I think, are readily available. You can very well give porridges with soaked chia seeds to children right from 7th-8th month, even later on. So chia seeds can be used in so many forms for vegetarian source of omega-3. Very good for brain development, particularly cognition and other things. Flax seeds are very common commonly used. So all these are very good source of omega-3.
I think many parents think, okay,
Yeah.
they should not eat citrus, they should not eat this, like they get this vaya problem, pitta, they have lot of these things.
Correct.
Should not eat these type of vegetables, they are cooling, they are heating.
Correct. Now
so
this
should not be there.
Yes, this is actually a large topic of debate, but what happens is they generalize. So it is from children to children, even
more
in
of a
adult.
myth.
It is myth, and it could be from child to child. Sometimes the children may have some issues, gastric trouble, acid reflux. So all children would not have.
But it's better to try and see.
Exactly.
Yes.
So what parents do is they generalize something and avoid a particular food completely. Some even try just because 1 or 2 incidents of diarrhea is there when they wean, they stop dairy, just like that. So that is such a good source of calcium. Everything that is required is just stopped by some parents. So that they should consult. Maybe
I think for special needs children, you should try everything unless they have any
please.
issues.
Yes, they should not think that the child will not tolerate. See, there would be issues of constipation in special needs children. One thing, because they are less mobile, because they intake fiber very less, there could be constipation. But this can very well be relieved. I think, could I stress upon pre and probiotics in this concept?
Yeah, sure, ma'am.
Because they also play a very important role in brain development, particularly if the gut health is good. Have you heard the phrase gut is God?
Right.
Yeah, so now they say gut is God, but that's true to a certain extent, at least when it comes to nutrition.
At one time we didn't know what was this, but I think now, especially with special needs children, gut issues are very common.
Very common. Why? Because one is fiber intake is very less. See, there are 2 terms, prebiotic and probiotic. We do not know the difference. Now, what is prebiotic is that feeds the gut bacteria, the beneficial bacteria in the gut. Which are they? They are probiotics. So you can directly intake probiotics in fermented food. So why we encourage on giving curd, yogurt, fermented foods, even our normal foods like idli, dosa, they are such good probiotics. We don't understand.
Okay,
Idli
even with any
dosas,
dal which ferments.
Exactly.
It's good.
Fermented, so sprouted, fermented, they add on very good beneficial
Even
bacteria.
sprouts, you mean they are?
They are not fermented, but sprouts can definitely add good bacteria to the gut. Definitely. And they are very good source of fiber. They are very good source of other micronutrients like iron, vitamin C. So please add sprouts, please add fermented foods, simple foods. Our local foods like idli, dosa, you can very well start at 6-7 months, just slicing the dosa idli in colorful,
I think
forms.
our Indian food is much healthy.
Yes, please avoid giving ready to, give a porridges, the Cerelac, examples. Okay, I would not mention that.
Cornflakes and all these
anything
things.
like that which is readily available in market to just made porridge and given, they are devoid of nutrients actually. In fact, they are packed with more preservatives, and for special needs children, this would be in fact be more bad than good. So please give whole foods, only then their gut will develop. That will only add prebiotic, fiber and good bacteria.
And you mentioned about probiotics and prebiotics.
Yes.
How much are they needed for these special needs children or like hyperactive children, autism, or they have any sensory issues?
Yeah.
How much important they are?
Yeah, it's not how much. Again, I was saying it is more about how good is it, what they give.
Okay.
So how much, there is nothing like specific grams, and supplementation is not always required if the gut health is good. So what are the signs of good gut health, right? The child should not have constipation. So definitely daily passage of stool should be there. If it isn't there, at least once in 2 days. So initially, definitely up to a year, the child will have constipation. Not just special needs children, most of the children have constipation because it could be due to lack of fiber, lack of fluid, so water they do not take. All these issues are there, but you should not consider it as a gut disorder. It is just because certain nutrients are missing. You have to give fiber, you have to give probiotics, prebiotics, and see that pre and pro are given together. Means for this good bacteria there should be food also, right? So you give fiber. How fiber? In form of green leaf like vegetables. Banana is a very good prebiotic. So banana is commonly eaten. Even here to children they give all sorts of different forms of banana in steamed or fried in ghee, slightly fried in. So these are very good source. Particularly I'll stress on ghee.
So ghee is very important.
Ghee is very important.
Many think ghee, they will become obese or it's fat.
Wrong concept. See, ultimately oil or ghee usage, the quantity matters. So you should not ladden the entire food in ghee and give, right? You can just brush it with ghee. You can use in some dips for the children. So such things, ghee at least a teaspoon a child can take, small. Initially small quantity like half a teaspoon.
Ghee is healthy for
After 1 year, 2 year, please give one teaspoon in a day, entire day. You can mix in rice porridges, you can mix anywhere, like ghee is very good. So it will also improve gut health. It is very much beneficial, and it has other micronutrients also because it is made from a dairy product. So it has its own benefits.
So like you give some examples of probiotics like fermented foods.
Yes.
So prebiotics like are found in mainly vegetables, fruits or
Fiber. Mainly prebiotics are all fiber. Banana and nuts also. Nuts and beans, particularly good amount of these beans, sprouts, as I said, they have very good source of
mainly
prebiotics.
nowadays children like French fries, potatoes.
Very true.
Are these also good for the children or bad?
Definitely bad. It couldn't be good in any way.
But if you make it homemade, like, you know.
See, children are ultimately children, no? They want good texture. They want something good to taste. So please make healthy snacks at home. Type of cooking is the problem. You know, usually we tend to deep fry, thinking that is only way to make a child eat because the texture is great. Not necessary. Now you have lot of advanced pans, pots, different
like
type of things.
Fries and
air frying and all. Yeah. But again, these are not very much recommended, but better than the packaged goods available in the market.
I think that is fine.
You have this grill pan, so you can very well make cutlets at home, fritters at home, you know, banana fritters, potato fritters, such thing in a healthy way. See that the nutrition is not lost, and give this as part of a balanced diet. What parents again do, give it as a meal, or you know, a snack is only that. No, give good fruits, along with it give a crispy item. So the child will have variety also, and definitely it will accept because there is texture, there is taste, there is color in the plate. So always look for variety.
Now some parents want to, like, you know, children have, especially in autism or Down syndrome, they will not eat proper meals. They have sensory issues. So they may miss out on some food. So are supplements required for the special needs children or the growing adults? And how far they are required, in which cases?
They should be tested. Definitely regular doctor visits are there, right? Regular pediatrician visits. From initial stages only, with every immunization also, they look for weight gain, they look for height, whether it is attained, developmental milestones. In special needs children, definitely the developmental milestones are different. There would be a different scale to judge it, isn't it? So you would know better about that. So when this is seen, they will know whether iron is deficient, whether calcium is there. So most common deficiencies still seen in children are these: iron, zinc. Most commonly seen. Again, this is not known.
But if zinc deficiency, how do we make out?
Zinc deficiency, again through symptoms. See, all that has protein has zinc also. So zinc is also related to growth, is related to neural development, cognitive function. So that has to all be seen by the pediatrician.
Because iron deficiency usually you can make out by like anemia.
Anemia, you can test
but
it.
But like zinc, magnesium deficiencies are not visible very fast.
But the symptoms. So if the child is not improving neurologically, so these are required for neurotransmitters, for the synthesis of myelin sheath in the neurons, particularly. So zinc, iron, choline, so these micronutrients which are not known mostly. You know, everybody knows about iron, calcium generally. Even these are required. Yeah.
But for a mental health development, now we are talking about physical.
Yes.
But sometimes mentally challenged children, you know, they are not able to say or speak out what you want. They may have some issues. So how far these probiotics, prebiotics or supplements will help in the mental health?
There are lot of studies done, particularly by supplementing. So what they have done is some nutritional supplements which are rich in probiotics, they have given to some amount, some duration in children, and it is seen that there are tests, right, to see the neurological development or how the disabilities have improved. So that those tests have proved to be correct, particularly with good probiotic intake, particularly if anemia is treated. All of this and other special diets are also there. I think we'll come to that, no, particularly.
But is there a particular duration if they start taking these supplements? Is there a particular duration, or they have to keep consulting?
No, they have to keep. See, iron and all is usually given later on. Like initially for a child for first up to 6 months, iron, calcium are needed. Now, particularly by default, it is given because deficiency is there. Right from the pregnant mother only it is there. So the child will be given. After 1 year, you have to test for it. Not necessarily to prolong it. It is not good to prolong. The child should always get micronutrients from food. So if your system becomes adapted to supplement, it is a lifelong thing. Then the system gets only through supplement. So please see, whole foods are given. For the iron, calcium, usually 3 months or 6 months, whatever is advised, follow and stop it with right advice. So take advice from nutritionist, please take advice from pediatrician and go ahead. Don't take decisions on your own. Yeah.
Now you were speaking about micronutrients are very important, especially I think for special needs children they are important. So how do these micronutrients prevent infections? Because most of the special needs children fall sick very easily.
Exactly.
The immune system is very low or they get allergic reactions very well. sometimes they are non-verbal, they're not able to tell what they have.
Yes.
So how do these micronutrients help them in their overall development or to prevent infections?
Yeah.
Can you explain to us that?
Yes, so one important nutrient for immunity is zinc. Already I mentioned that was there. Iron should be there because anemic children again are very low on immunity. They are prone to infections. One very important nutrient missing is vitamin C. Again, vitamin E. Now, how to get vitamin C? C is definitely there in all citrus fruits. How do you add? Child may not be eating fruits, you feel. So at least squeeze lemon into their foods. Maybe simple things like you're giving a green leafy vegetable sabji or you're adding somewhere, you please squeeze lemon. Okay, so such things are very important, and don't give only non-vegetarian food. The C, E and all are there mostly in vegetable and fruits.
I think many of the children tend to eat more of non-veg. It's because of, I've seen biting sensations or something. But they need to have some vegetables at least.
Yes, some not daily. It has to be in good portion. In fact, fruits and vegetables both. So at least snacking can be done with that.
More of raw vegetables can it will be
raw
helpful?
is a good prebiotic actually. When given raw, they get good fiber. If they have good denture, if they have enough swallowing, most, as I said, children have dysphagia, swallowing difficulty, right? Down's syndrome particularly, children, they have dysphagia and they prefer soft foods. So you can give soft foods, but give healthy foods. It need not be all mashed puree, right? Like for example, idli dosa is also soft. Right? Or wheat instead of chapati, you can make dosa and give. Ragi, if you have to incorporate, please give in dosa form. Or make like, this cakes we make out of it. Like ragi can be used and made cakes out of manni sort of cakes. So please, you give soft foods, but give whole foods. Don't juice everything. Don't puree everything. It is devoid of fiber.
Indian foods are very much rich in all these things.
Definitely. Simple ragi, ma'am, like the millet ragi has calcium, has iron, has good fiber. Particularly if you sprout and then powder it, the benefits are double.
Then speaking about ragi, how much it's helpful, because it's sometimes they say it's digesting, it takes more time or it's difficult to digest. Many have these misconceptions.
Use in lesser amounts. See, again, just because ragi is good, you don't have to use daily. Particularly in grains, all the cereal pulses, you have to do rotation. Then only the digestion improves. Meaning, for a child, don't use only rice. So in one meal, you keep little amount of rice. In one meal, maybe wheat. In one meal, ragi. Or in weekly 2-3 days, give ragi. Other days, give rice and wheat. Different millets. And even in pulses, you do that. If the child likes only one, maybe green gram, don't give only that. Introduce to new grains. Horse gram is there. Chana is there. So all these have different micronutrients again. It's not only protein. It's about again micronutrients. Yeah.
Like most of the South Indian, they prefer dosa idli. But when we come to North India, because India is a state which with different people, they prefer more of chapatis.
No problem.
Like children like to bite of chapatis. But sometimes nowadays this has come like, chapati is not good, wheat is not good, rice is better, or rice is not good, wheat is better.
Not at all.
And many children advise gluten-free diet. So how are these diets helpful, and is really gluten that bad for all these special needs children?
No, now I'll talk about gluten-free only particularly. See, where is gluten present? Wheat products mostly, barley. Now again, most parents don't know where is barley there.
Barley also has gluten.
Exactly. Now barley is a hidden source. Rye, there's something called rye. Now this barley rye we don't commonly use in our kitchen, but they come hidden in lot of bakery goods, particularly malted drinks. Lot of them are in a habit of giving, I can give examples of brands, right?
Sure.
Something like Horlicks, for example, malted drinks, we advise not to give. Instead, make your own malted beverages at home through ragi and all. So barley has lot of gluten. Now gluten-free diet is not advised. Like, you don't have to be gluten-free, but reducing gluten in the children. There are research articles. I particularly went through some. I think as recent as 2021, there was I'll just tell you about that article. Yeah, so where, by reducing all these bread, cakes, biscuits, all the hidden sources of gluten, what is there in these? Refined flour. So ultimately wheat products, so refined flour comes into picture.
So maida is part of that.
Yes, maida is refined flour. So many children who are taking cakes, biscuits, bread, if they are kept away from that, these special needs particularly children, and given healthy snacks, lot of improvement in the motor development. GI issues, in fact they face lot of GI issues, gastrointestinal issues like nausea or constipation, sometimes vomiting, diarrhea.
Sometimes they are not able to say also if they are having stomach issues.
Diarrhea. Only if you see diarrhea diarrhea and all, you will know. So if they simply have like colicky pain, you will not know. Yeah, but with reducing gluten, these have been shown to have good benefits, but it is not all for one rule. That is the ultimate thing.
Differs from children to children.
You have to have one-on-one consultation with your dietitian, with your pediatrician. See that whether gluten-free diet will work for this child. If the child already has a lot of deficiencies, you simply again don't have to avoid.
Because we have seen it's very common, because autism children, if they are hyper, they will advise don't put them on, remove gluten from their diet. They will hyperactive will stop.
It's not about hyperactive. It is actually their different behavior. It's called behaviorals, right? Behavior. And with gluten-free diet, behaviors like these autistic behavior or other things have been found to reduce. There are articles. So there are many research articles for that to prove
But as such, in limited quantity, everything is fine.
Yes. Again, don't do it on your own. Okay. Now gluten, you really don't know the source. In bakery goods, there are n number. So even in simple sauces, soy sauce, some tomato sauces, packaged foods all have some hidden source. So look for the label. Again, you have to see gluten-free, or if there is any hidden wheat source, oats in some products. So now they even make oats without gluten. So there are packet foods.
They think oats is very healthy.
Not really. It's something not needed actually, but you're using very well. Use it. Oats is not bad also. Not needed. It is something not needed. It is only.
Our traditional foods like chapati, dosa, they are the best.
For North Indians, as you said, parathas, and there are even things like dhokla. These steamed puffy things. No, not just dhokla. There are so many steamed items in Gujarati cuisine and all. They will like it.
Children I think our traditional cuisine is much better for
yes. Any local area for that matter. For India, our local food.
I think parents need to know, like, you should not avoid anything. Everything in moderation is fine. Having chapatis few days, having dosas few days, because some of our children have certain particular issues. Like I have a son with autism. He can't have something which is very sticky and soft. He will eat a crisp dosa, but he will not eat a
this
soft
I was
dosa.
saying. They have their own perceptions. So they choose certain textures.
Because sometimes they have issues with their mouth which they can't express.
Yes.
But we try to make it in a different
label
way.
them as picky eaters. So what we do, okay, my child is a picky eater. Or we only select 5 foods, daily you give only this. What happens, the child makes that a habit. Unless you introduce, the child will not eat.
Coming to this, ma'am, in autism children, mainly we see they have a lot of sensory issues with food.
Yes.
Like they may not eat this stuff, they may eat soft, some don't prefer hard. So, like you said, they are picky eaters. So, what can be done to help these?
So, mainly you have to consider a lot of things here. It's not just about their plate. Okay, definitely plate, if a mother is told you give lot of color, you give lot of shapes, she can do it. They will do it. And particularly, special needs moms put lot more effort, I feel, than other normal. We may not. Like if she eats, let she eat sort of attitude will be there. But you will be having, so much concern because child has other issues, right? But not just the plate matters, the environment matters. So eat with the child. That is very important. So family meal times should be there.
I think they learn from example.
Exactly. And don't treat the child as a special child, in a negative way, like by isolating or by not allowing to eat with others. So please put them on the dining table. A high chair is very useful. Now it's readily available, right, with the tray. So allow the child to self-eat. How will they learn textures? Only by touching. So if you keep on feeding, spoon feeding, they will never know what is a texture. What is smooth, what is hard, only they will not know. You're just putting everything in the mouth. And the environment without distraction is very important. No television. No
it's
other
more
distraction.
Of a family time, I think.
Yes, it has to be with others and they see and learn. So if there are other children who are not disabled in the family, that's a very good example again. If a child who is eating well, keep that child at meal time with this child. In fact, siblings help a lot. They like to feed their younger ones. So they happily feed them. They will like it. And that way you
Because these children don't have friends, so I think siblings are the best teachers. If the siblings are eating, they also learn a lot from that.
Exactly.
So I think parents, they need to know that, make it more of a family time. And what you are eating, let the child try that.
Yes, and don't emphasize on quantity, quality is important. It is always when you force feed, the child will automatically develop aversion to that food. Next day you give that forced food, it will not eat. Because you have forced it previous day. So it will automatically avoid. That is the psychology.
Drinks also, instead of having water, they will start with juices.
Don't do that,
milk,
please.
With food, milk they will have.
Not good. Now for this there is another very important aspect, ma'am. Whenever you give milk products, don't give at meals which have iron rich foods. Now what are iron rich foods? Like whole egg or meat, or you're giving chicken to the child, or you're giving whole pulses which are sprouted. These are all iron. With this, if you give curd or with this you give milk,
No milk
calcium
products.
comes there and it impairs absorption of iron.
So it's better to avoid milk products.
Together,
Okay.
meaning iron and calcium. So you should know the calcium
But
sources.
many of the parents put curd like with the rice when they eating
And
like
mix.
non-veg or vegetables.
This is a no, actually. This is a no. You can do it on some times. Maybe a
Rarely.
child has not eaten full day, night it wants curd rice. Please give, no problem.
But
It
try
is
to
not
avoid.
poisonous or harmful. What happens is micronutrient absorption is impaired. Iron and calcium are antagonists, meaning
Okay.
not in the same meal. You give calcium-rich food in the evening. Give a glass of milk or give anything later. Give
But
curd
try
separate.
to avoid, you mean
Together.
as much as possible, try to avoid with iron food,
Yes.
milk and any products, because
Yes.
most Indian parents, I think they think curds is very good, so every rice like they put curds.
Exactly. And
along with-
sometimes egg and curd is given together.
And more with
Very bad.
vegetarians also, curd is one of the staple
Yes,
food.
yes, yes.
And with any vegetable they use curd.
Yes, particularly some groups like Brahmins or such
Right,
groups,
right.
they have a habit of eating curd along with meals. It's not always harmful. Maybe in some other meals they're doing it rightly also. We do not know. But see that every meal at least you avoid it.
Because I think with normal children, they don't, they react very fast. With special needs children, we have to make one step ahead and be little careful not to
Yes,
mix up
because
these foods.
micronutrients is a concern.
Right,
No? And when iron is there, please give vitamin C. Otherwise, iron is not absorbed.
So vitamin C again natural, or we have to give supplements?
No supplement. You please give, just add lemon. It is
Lemon,
enough. Potato is a very good source of vitamin C. Most
I
of them
think
don't
right.
know. So some simple bhaji is where palak, potato you
Oh,
mix.
potato is very
becomes
good.
iron, vitamin C. Yes,
So
potato is
children,
very
I think
rich in
most of
vitamins.
them love potato, so maybe we can add potato
Definitely,
any dish.
any dish, and where there is iron, you please add like green leafy vegetables
Right.
and all. You please add, and
Even
potato.
with non-veg food, I think if you put in some potatoes, it's
you
healthy.
get iron, vitamin C together.
Oh,
So
that's-
that is the advantage. Please do not go for supplements for vitamin C and all. You get enough vitamin C through fruits
And
and
lemon, I
vegetables.
think in Indian, again, it's a staple diet for
Yes.
everything. We have
And
used lemon.
if you see, children like sour. Most
Right,
children, right? You give a lemon in hand, they'll just
Many of these special needs children have a habit of biting a lemon also.
or tomato. You give a tomato, they
Tomato.
tend to eat. Yeah, please give. So give it as a salad before a meal, and then they will eat the meal also. They get good
I have
fiber.
like my son, he loves to eat gooseberries,
Good.
amla. Just
Which
like
is
that.
source
Many
of vitamin
children
C.
do that.
Yes, highest source of vitamin C is amla.
Yeah, we
gooseberry.
can't expect normal children to do that, but special children will have some different thing, they'll start eating something which we don't even expect.
Exactly. That is why, because they are perceiving that they like it. They like it by taste.
So that's a good
And
habit.
usually special needs children may perceive spicy very fast, unlike
Right.
other children. So even little spicy, they may feel it is too spicy. So don't really give chilies. As such, you don't have to give until they become
Right.
5 or 6 plus. You can very well give other herbs and all. There are so many herbs to flavor the food, right?
Pepper is again.
Pepper can be used. Please use crushed pepper, not the ready-made powders available in market.
Okay.
Please, whole pepper you crush and use at home.
Okay. I
Or
think-
herbs. There are like
Yeah, in Dakshin Kannada, pepper is one of the.
yes, and lot of whole spices. You can use coriander powder in food, jeera powder in food. Use garlic. Garlic can also be powdered and used. This gives flavor to the food. Children will like it.
So natural herbs and spices are very good.
Yes, use tamarind. Wherever possible, use
Okay. Oh,
tamarind.
tamarind also is very
Child
good.
will like, and tamarind is again vitamin C.
Right.
Yeah.
So again, we're coming back to milk. I think some of the children, doctors or pediatricians advise to go on a casein-free diet.
Yes.
Avoid milk completely.
Yes.
So how far is it helpful, and is it really true that milk is not necessary for children?
See, it is mainly to do with the type of protein. Like in casein, you have two types, alpha and beta casein. Now, what they link it with is, there are studies actually, it produces certain compounds. Okay, there are peptides when it digests, which act like certain neurotoxin. Okay, means which impair certain components in brain development. Okay, and in special needs children, casein is not digested well. Casein, you understood, right? It is
Yes.
a type of milk protein actually. There are two types, alpha and beta. Again, there are theories which tell beta type of casein is better than alpha. Now, how to get beta casein is, our native cow breeds are there. This A2 milk, there's a lot of talk
Nowadays
about
A2 ghee is coming.
A2 ghee, A2 milk. Now, A2 milk is not a necessity. Again, they have seen through research that this beta casein also is not very different from alpha casein. Only thing, it has shown some improvement in the behavior and neurology by using beta casein protein, means A2 milk. Okay, but there are no enough studies to tell that A1 is bad, A2
So nothing like milk is bad or
casein protein is bad, nothing like that. Again, with casein free. See, there are alternatives for milk. Parents should understand this also. There is enough good calcium in other sources like coconut milk, almond milk. Right, you can use this also. Then definitely you can use these milk also.
especially I think South Indian food is rich with coconut.
Yeah,
So,
so
milk
please
is not a
extract
necessity.
coconut milk. Okay, you can, from one coconut you can very well get like half a liter milk and all. Store it for 3-4 days. It can be stored in fridge. Use in food. You can make puddings out of it for child. Coconut milk only can be given as a drink by adding something, to flavor it.
But without milk also it's fine. Like we get that much.
No, dairy
nutrients.
in any form, dairy as such, cow milk only is not needed, but almond milk. Now what happens is nowadays even mothers breastfeed a lot, like till 4-5 years.
Right.
Very good practice. This also I would like to talk about. So again, in special needs children, in fact today morning I read an article where breastfeeding was linked to improved intelligence and development. This was a 2018 article I read just recently. Longer the duration of breastfeeding, the intelligence quotient in special needs children was more.
Okay.
Means they improved well.
More.
So they could grasp better, they could grasp things better, or whatever training is being given to them, or what special courses they are on, the results are better. So please, I would insist breastfeeding mothers to do
Continue.
it as long as possible. Definitely it's not possible for working mothers and
Right,
all, so but at least keep one time feed, maybe night feeds or early morning feed for the child till 3 years, 4 years. It is possible.
So like whatever you say, whatever instinct nutrients in milk, they are present in other foods.
Yes, and
So
until 1 year, mother's milk only is a complete nutrition.
But
later you need other sources of milk also.
like
after 1 year.
curds, cheese, some children prefer.
Please
so
give
those
cheese.
also good.
Cheese are very good, particularly our cheese, the Indian cottage cheese, paneer.
Paneer.
Please give that. So right
That
from
is very good.
right from 7-8 month you can introduce paneer to child.
Okay,
So
okay.
and you can make lot of things with it. The child will like the texture also,
Right.
right? And you can even make sweets out of paneer instead of giving these sweets brought from out, which are very like with refined maida and all. Make sweet from this koa, paneer,
In
fermented
Indian,
again.
we have lot of foods, desserts with cottage cheese.
Something like kefir also you would have heard. They give it in a form
heard
of
of
drink.
that, but
It is made
yes.
from fermented milk only, kefir
Okay.
or lassi.
I think lassi is
traditional
very
lassi,
traditional,
yes,
buttermilk.
fermented again, buttermilk, lassi. These will add again probiotics.
Again, back coming this Indian foods are really very
Please,
good.
yeah, always. And now from India all over it is going. No? So
Right, right.
outside,
Indian food is becoming very famous. which is
coconut
more
coconut
healthy.
milk is becoming superfood outside, whereas
Right.
we are using it less, thinking it is fat,
Right,
which is
right.
a myth.
I think it's not a fat because there are many people thinking coconut is not good for health.
Coconut does have fats which are bad, yes, but anything eaten in moderation is good. In fact, it has MCTs, medium chain triglycerides, which are good fats also. Those are absorbed well. So instead of taking some other bad saturated fat, please take this which is absorbed faster
Right, right,
into your system. So it is not really storing
right.
in the body. Yeah.
So coming back, ma'am, most of the special needs children we will see either they are overweight or some of them are underweight.
Yes.
So these all because sometimes it can be because of medication or because of diet.
Yes.
If they're not eating properly, eating junk foods. But some of them are again on psychiatric medications which again change
Side
their
effects
weights.
of, yes.
Or yes, like you said. So how can we manage them with a proper nutrition, or what can we do to help these children?
Yes. See, overweight is something mostly seen, I think, in Down syndrome, right? Because Down syndrome children, one is their metabolism as such is slow. The metabolic rate, should be good. Means they burn calories faster.
Okay.
If it is good. So if metabolic rate is slow, they don't burn the calories. Means the extra fat calorie coming from food is stored. Otherwise, generally children burn very fast because they are always active. They move around or their mind is always occupied. So they burn and their metabolism is good. But in Down syndrome or cerebral palsy or where the muscle tone is affected.
Wheelchair.
Yes, wheelchair children. Muscle tone itself is not great. They don't really have good mobility.
Right.
They have very low metabolic rate. So that is the reason for overweight and obesity. In these children, as I mentioned right in the beginning, emphasize on nutritional quality and not quantity. So calorie is not important. The density of nutrients in it is important.
Again, coming back, they have these thyroid issues. If
Yes.
again the same issue, ma'am.
No, if hypothyroidism is there, that has to be corrected. So they have to be under medication for improving the thyroid hormone level. Only then the weight gain will
Right.
not happen. Otherwise, with their disability, if thyroid disorder also is there, it is very difficult to lose weight, or it is very difficult to manage weight in such
But
children.
how nutrition will help in the case of thyroid, like
Thyroid,
hypothyroid children
particularly,
have?
you have to avoid goitrogens. Okay, what see, goiter, no, thyroid is
Okay.
ultimately what happens when the gland enlarges is goiter. So goitrogens are there in particular food like cruciferous vegetables. These are broccoli, cabbage, cauliflower.
So should avoid this.
Should avoid, even for children. For anybody with thyroid disorder, you have to avoid goitrogens. And mushroom also has goitrogen.
Oh, mushroom is not a
Not good for
source.
thyroid issues.
For others, it's really good. Ma'am?
Mushroom is good. Yes, mushroom has good protein also. It is a fungi. It is not really a vegetable also. It's not really a animal food also. It is a fungi.
Something, like these vegetables and even root vegetables are
Yes.
not good for children.
They are
So,
good. Why not? Root vegetables
Because
are
some
good.
of them have this because they have more of starch. They
No,
have this-
see, particularly sweet potato and all, even if the child is diabetic, it is advised to be given because it
Okay.
has micronutrients like manganese and all, which improve the sugar levels, in fact. So please give sweet potato, please give root vegetables.
So all
everything
sorts of
in
food are very
moderation.
good.
Yes, everything in moderation.
Because some children will not tend to eat fruits again. Especially I've seen in sensory issues children with autism or hyperactive, they will not eat a particular type of
Exactly.
fruits. So
See,
they
one thing you can do is incorporate desserts that time made
Right.
out of fruits where they may
they
like
tend
it.
to give juices sometimes because the child is not eating apple. They will make a juice or
No,
they'll make a
juice
milkshake.
is not advised. See, milkshake again, some fruits, no, particularly mango and all, when you mix with milk and make a milkshake, you are causing more toxins in the body.
Okay.
You can use coconut milk that time.
I think
Understand?
parents need to know because that is one of the delicacies making
See, now the
mango
smoothie,
season.
for
mangoes.
example, smoothie is a trend, right? But
Right,
when
right.
they do combinations of some fruits with milk, particularly berries, mango, which are very high in vitamin C and all, should not be given. They create toxins in the body. You use coconut milk there, you use almond milk there, it's okay. Understanding? So
Okay.
use same food groups to make one particular, don't mix food groups.
The parents
you
need
create
to learn that
toxins.
because
Yes.
especially mango season, first thing they end up is making milkshakes.
Do not do juice. You can do pulp, no, mango pulp. Yeah, or add something like, there are thickening agents which are healthy, something like agar and all.
Agar, I
You
think-
make a dessert for them,
Like
mango
amras,
jelly.
which we eat, that is
amras,
healthier.
exactly. Or amakhanda. There is one more thing, no?
Amarkhand.
Something like that.
Amrakhand, something, yeah.
Yeah, that is also
Shrikhand, like a
Shrikhand,
Shrikhand,
like a
it's like
Shrikhand, yeah.
Amrakhand.
But don't add milk there. Make it with coconut milk or make it jelly like and give dessert.
Okay.
But again, if you give only this, child will not eat whole foods later on, whole fruits. In between, you introduce pieces also.
Yeah, little means everything
Little
of
bit.
little is good.
Or make something like in a simple toothpick, you can mix 2-3 color fruits and give them. So looking at it, they will eat.
I think
If you chop
traditional-
and give them and not eat.
Traditional fruits like jackfruit and
Yeah.
those also are very good.
Seasonal fruits must be given. There is a reason why these seasonal fruits are there in that season.
Ice apple.
Yeah,
we
but
see them
another
jamun.
very important message here, don't give seasonal fruits in non-season.
Also,
Now what happens is throughout the year mango is available. Parents are very happy because
Right,
but
that's
that time the nutrient is not retained. The 2-3 months when mango actually is taken from the tree and eaten, that is when the nutrition
But
is
they
there.
freeze also because to use it throughout the year.
Yes,
that's
nutrition
not
is
healthy.
lost. Some amount. Definitely all of it is not lost. Some amount is lost.
Okay.
And not healthy. Yeah.
So now when we see a specialist child, exactly I think how will we make out that they have some nutritional defects or they have some issues. So unless we take them to a doctor, you
Yeah,
can't
yeah.
make out. So
You
what
will have to. If you see, usually small deficiencies will be there. You have to give balanced diet, correct it. But if there are severe deficiencies like anemia which is not getting corrected or always below 7 and all, then you have to correct it through supplements. You can't wait to do it only through food. It doesn't happen, and they need supplements because until the age of 2, particularly brain development is maximum. So there, simply thinking that food is correcting it is wrong on the part of parent also. It should be given through supplement because that much brain development, what happens up to 2 years is very important. Later that
Right.
doesn't happen. So later the cognitive ability can always be low if you don't supplement. You have to. But there are tests for that. There are various cognition tests for children.
Right,
That should be done. Iron blood test should be done. Calcium also can be tested.
I think food
Vitamin
allergies
D.
also there's a test to
Definitely,
see.
definitely. Food allergy, they do it through prick test. They
Okay.
prick and check with different foods. So milk allergy and all is found out like that. Lactose intolerance, milk protein allergy, such things are very common.
I think unless the parent knows a child has allergy, please try all sorts of food.
Yeah, don't assume and avoid, definitely.
Right.
Please, once you know for sure, only avoid.
Sometimes we
Don't
think because the
assume.
parent has a problem with this particular food, the child may have.
Not always.
It's not necessary.
No. If parent has been lactose intolerant, not necessarily
Not
child.
necessary.
will
It's
be.
not genetic.
Not at all.
Anything
Allergies, food allergies cannot.
it's
Need
not
be
genetic. I think
yeah.
parents ought need to know that any food allergies, anything to do with food are not genetic.
Not
So, it's
necessarily. Some very rare things are there which can be, but that is not of our concern at all.
So
not,
we need to
not
try
here.
every sort of food unless a child rejects it to
Yes.
do certain reason.
Child rejecting is one thing, but child showing symptoms is another thing. So frequently there is diarrhea with one particular food, or always there is some rash around the mouth with one food, definite allergy, that is, avoid it. Then you should again reintroduce. What parents again do is, once doctor tells, okay, your child is allergic, you avoid it for lifetime. Don't do that. After few months, reintroduce in small quantities. After, step by step introduce one allergic food, the child will again start tolerating. It's all up to a certain age.
But some children will develop mouth ulcers.
Yes.
Is it because of food?
B
or
complex deficiency. See, very common now in children around 4 to 5 years. What we are seeing is the tongue becomes swollen. You can that what you call proper shiny
Thick, it
appearance,
becomes a
thick and shiny surface. It's
Right,
very
right,
common
right.
in children. So parents most of the time they don't know why the child is not eating. Little hot you give, a little spicy, they just throw the food.
Become
You
sensitive,
have
yeah.
to test the child for B supplement, B complex.
But sometimes they get
B12.
boils inside the, mainly many special children, autism children we have observed, they get mouth ulcers, like
Yes.
inside 1-2 balls are always
B12
there.
deficiency.
It's a B12.
Most common reason is B12. You supplement the child with B12, drastic improvement in the
So
symptoms.
for that we need to test before?
Yes, it is tested for, or the doctor themselves identify with the symptoms only.
Okay,
They
for
will
that-
give for B12 supplements.
For that we need to go to a dentist or
Oral, yes, dentist also will identify, or pediatrician only will identify.
Okay.
So usually parents go with complaint that child is rejecting all foods. No, when they check the oral mouth, all the things in the mouth only, they'll understand this is the problem.
so mainly ulcers
Now
if inside the
B12,
mouth.
why deficiency is a question again. See, B12 is present in non-veg food. So mostly in vegetarian, vegan families, we can find it very commonly. Or if the child is not at all eating anything like egg also, B12 particularly. So B12 is there only in dairy, egg and most non-veg foods. So to get it through the veg food is very difficult. Very
Nowadays,
small amounts.
coming back to vitamin D deficiency,
Yes.
which is very common.
Not just children, even in adults.
Adults,
Yeah.
but especially is more because they don't tend to go out much.
Yes.
So
no
what
sunlight.
food can replace that?
Yes, so sunlight is the first main source. You should try to expose the children also in the morning time. Somewhere around 10 a.m. To 2 p.m. is the best time for deabsorption. This is again not known. So you think any sunlight is okay, no? Early morning also is
that's
okay.
not,
that is not
true.
very beneficial. There is less amount. So more, amount of vitamin D is got at this time, 10 to 2. That is what is seen through studies. But it's not that you go and stand in the sun or expose the child till the skin, has a burn.
Burns. Right,
So please only for 5-10 minutes you expose the child to sunlight. If sunlight is not available, or if the child is severely disabled inside the house, then supplement, yes, but there are foods also for vitamin D. So egg gives both calcium and vitamin D. So please give egg. There are dairy products, and now in fact milk comes fortified. Most
Right.
of the
But
milk
that is
available.
true, ma?
Yeah, but if they fortify, it is true only. They can't label falsely as fortification. Fortification means adding something which is not there. Okay, that is different than supplementation. Okay, this is fortification. Nutrient is not taken as supplements, added to food. So from there it is absorbed.
So if it's
you can give
fortified, it's good.
fortified wheat flour.
Okay, wheat flour
Fortified
also
milk.
fortified.
Yes, salt is fortified, wheat flour is fortified, milk is fortified. Now particularly nutrients of concern like vitamin C, D and all are fortified. You would have seen oil also.
Right,
This is
right.
fortified with A, D, E. That is sometimes marketing strategy.
We think it's just a label because too
No,
many
there
things
what
are
you have
there.
to see is whether that fortified nutrient is not there in food or not. You should first understand.
So better to
Simply
get
do
from
I need
food.
it? Yeah. Simply do I need it through oil? No. In fact, that oil may be doing more harm with saturated fat there, or with the refined oil. It is harmful.
So vitamin D is more of egg, and what are the
Is there
things
in
we
egg?
find?
Milk products
Milk
have
products.
it. Yeah. Mostly, but very less amounts. That is the problem. What you get is very less amounts.
So sunlight is very important.
Yes, mushroom has vitamin D.
Okay,
Mushroom
mushrooms,
is something
okay.
which is not known. Dry fruits have.
Or dry
Particularly
fruits also.
almonds and cashew have little
I
amount.
think we need to have more of these
But
natural.
they will give you more calcium
sources.
also. In fact,
Okay.
nuts, if the child has good amount of calcium
Cashew nuts
also.
also, because Mangalore is like cashew nuts, peanuts.
Please
and
give children, you give any amount, no? They don't have concern
Okay.
of cholesterol or heart arteries getting blocked and all
Right.
at this age. So please give nuts also.
Lots of
These are in fact healthy foods. Rather than giving them other crispy deep fried snacks,
Okay,
nuts you
nuts.
give. Simply dry roast them and give.
I think more people should take the children out, because when it comes to special needs children, they tend to keep them at home.
Yes.
So we need to, unless of course it's raining
But I'm
heavily.
sure groups like what activities you are doing is helping the mothers now to get them
Hope
out.
so, yes,
Yeah,
hope
what
so.
mothers used to do is they used to think we should hide the children
Right,
and keep,
right.
or these are not socially accepted. That's a very wrong thought.
Right.
First of all, the child is special. That is a kind of blessing I feel for the mother also to take care of such special
Right,
child. Right? You should encourage such activities.
Right,
Yeah,
right.
definitely.
So like I think we need to have a more inclusive community which we are working
Yeah,
to.
something like our group itself. That's a very
Thank you, ma'am. And before we close, ma'am, through this channel News Karnataka, what message would you like to give to everybody?
Yeah, as I already said, I would firstly hats off to the mothers, who are taking care. Not just mother, I am already, telling mother. It's a duty of both the parents, that is father and mother. So don't make it always about the mother. So father also, I would suggest, in fact,
Very
the fathers
true.
who are seeing, please support the wife, help them in raising the child. As much as possible, give a hand whenever you are at home,
Right.
whenever you go out also. In fact, see that you also share responsibility. That is one message to the fathers I would like to give. And other than that, to the mothers who really have, who are very scared to take their children out or think that they're prone to infections and all, don't do that. The more they go out, in fact, the more they're exposed to soil, rain and all, the immunity develops.
Right.
So you think they should not play in mud, you think they should not get exposed to rain, it's wrong. The more you expose, they may catch cold once or twice, but that is needed for the body.
They'll have immunity.
Yeah, they will develop good bacteria only then. Otherwise, if you don't expose them at all, the moment they go and mix with other children, they can easily get the opportunistic infections.
True.
So you make them strong from inside, and then to send them out or to make them, to go to any social gathering and all will be much easier.
Right.
For you also, for the child also. And it will stop falling, sick. There will be less sickness if you expose the child more to all these natural things. Yeah.
Thank you very much, Chhaya ma'am.
My pleasure.
We have learned a lot about nutrition today.
Thank you.
And if any parent has queries, please write to us, News Karnataka. Chhaya ma'am is a certified nutritionist. You can find her at Maitri Clinic. You can approach her for any of your nutritional needs. And parents, please see that you give your child everything. Try everything. A little bit of everything is better. Everything in moderation is good. Please take your child out, give them proper sunlight, give them proper nutrition. And our Indian food is really rich source of all vitamins, fibers, everything. So I think we are lucky to be Indians, and especially in Dakshin Kannada, I think we have got a lot of
We
natural
have our
things.
coast, so that is a very good source, as I said, for fish particularly. Yeah, fish and seafood.
Right.
Encourage the child to eat. Yeah.
Yes, yes. So thank you everyone, and we'll be back again. Thank you.
Thank you, ma'am.